Hi, my name is Nicole Daniels. I am a BSN student nurse at Indiana State University, and today I am providing a health promotion on promoting good sleep habits for teens. The population at risk targeted are teenage adolescents between the ages of 13 and 18. Our objectives today are to discuss factors that lead to sleep deprivation in teens, list risks associated with poor sleep habits, to describe some recommendations for healthy sleep patterns, to define interventions that adolescents can use to improve their sleep health, and also provide some resources for further information and education for adolescents and their parents as well. Before we get started, let's first check your knowledge. If you look below the video, is a link for a test that you can take both before and after our presentation today to see what your knowledge beforehand is, and then also just to recheck your knowledge after the fact. So hopefully you'll be going away with a little bit more information than you had before. Some factors that lead to sleep deprivation in teenagers. So as teenagers, you have increased amounts of homework. You're working academically to prepare for college, so you have a lot of homework to do at night in those classes. Another big factor is screen time. A lot of teenagers spend a lot of time on their smartphones or their devices, watching YouTube videos, going onto social media to talk with friends, FaceTime, playing a lot of video games, PlayStation, Xbox. So that leads to what is called blue light stimulation. And when that's at nighttime, it does make it more difficult for the mind to relax and be able to go to sleep. Other things that teenagers are living with is shifts in hormones. So they're having changes in their hormones, such as melatonin. An increase in melatonin can make it more difficult to go to sleep. Also, their circadian rhythm is changing. So many teenagers get into that rhythm of staying up very late. And then, of course, when they have to get up early for school, they're not getting enough hours of sleep. And then also multiple extracurricular activities. A lot of teenagers have very busy schedules. They might be playing sports and involved in clubs. Some also might have an after-school job. So risks that are associated with poor sleep. In a lit review on per Gong et al. In 2019, some of the major risks associated with poor sleep. There's some major risks that there are associated, and we'll go over some of those in just a moment. And 40% of adolescents are impacted by higher activity level late in the day, such as going to sports after school or going to an after school job. And so therefore, when they're starting those activities late in the day, it leads to them going to bed later at night. And that is something that we call eveningness. So some risks that are associated with that term eveningness of going to bed later because of a high activity level late in the day. Some risks that we see are depression, anxiety, and or different emotional instabilities, difficulty concentrating, which can be problematic for your academics, substance abuse and impulsivity, decreased physical activity, and then because of that decreased physical activity, seeing higher health risks such as obesity and diabetes as well. So recommendations per the CDC and a national sample of data that was collected in 2015, they found that 7 out of 10 high school students did not get enough sleep on school nights. And so that was considered to be around 7 hours of sleep. So per nationwidechildrens.org, the average amount of sleep that ideally teenagers should be getting is 9 to 9.5 hours of sleep. So for this reason, the American Academy of Pediatrics named sleep deprivation a key public health concern, particularly in the adolescent population. So some of the different interventions that you can try: setting limits or a curfew for the use of electronics. Not a popular opinion, I'm sure. I know teenagers today are attached to their devices. However, your sleep is very important. So set a limit. If you're going to go to bed at, say, 9 o'clock at night, Make sure that you put the phone down around 8 o'clock to give your body time to adjust and relax, minimizing that blue light stimulation. Stick to a routine and a schedule. So set a particular bedtime. You plan to go to bed every single night. And then also your rise time. What time are you going to get up in the morning? And stick to that routine. It'll help to adjust that circadian rhythm and get it back on track. Environmental controls, you can monitor and control those, such as making sure that your room is dark, turning off the TV, a quiet environment, and also an appropriate temperature, cool temperature, so that you want to have your blanket and be comfortable. Space out large meals and caffeine from bedtime. So, any caffeinated drinks, sodas, tea, if you drink those before you go to bed, obviously you're going to have a harder time going to sleep. So you want to make sure that you're putting a good space out, between those. And maybe at dinner time, you eat a smaller portion and you drink water instead of soda or milk instead of soda. Increase exercise during the daytime hours. If you do your exercise earlier rather than later, also would help. And if these interventions aren't helpful and you continue to have trouble with your sleeping, then you want to contact your doctor for further evaluation to make sure that you don't have some sort of sleep disorder. And they may want you to go ahead and keep a sleep diary as well. Another approach that's becoming popular is cognitive behavioral approach. There have been recent and ongoing studies that have been conducted with positive results using a transdiagnostic sleep and circadian intervention. So, in this approach, multiple multi-module sessions are repeated over a period of several weeks, and they're establishing regular sleep-wake cycles, providing education, particularly looking at behavior change and motivation techniques. And of course, setting personal goals is going to be a key element because if you yourself are involved in the process, it's more likely to be successful. As a teenager, we recognize you have a lot going on academically, athletically, maybe. Socializing is very important. Family life, juggling learning to drive and driver's ed, extracurricular activities, the need for downtime in between, and also trying to prepare for college. There's a lot going on. But guess what? There is someone else that used to be in your shoes too, your parents. So let them support and help you. Be honest with them about your sleep habits. That's what they're there for. They're there to support and help you. So, provided below are some resources where you can get some more information about all of the information that we discussed today. CDC website, lots of different educational tools and tips for sleep health. Nationwide Children's Sleep Disorder Center, they've got some great resources. The Child Mind Institute, and then also Johns Hopkins Medicine. They have education tools and tips there as well, but also they teach on some different stress reduction techniques like gentle breathing or muscle relaxation that you can try to see if that helps you with your sleep and relaxation. Okay, just want to thank everybody for attending today. Please remember to complete that post test to check your knowledge before you go. And I hope you have a great day.